In this video, we're going to be discussing the anatomy and important functions of the phrenic nerve. Now, the phrenic nerve is a mixed nerve whose motor component innervates the thoracic diaphragm, which is the major muscle of inspiration or inhalation. Even though we have the external intercostal muscles, without the diaphragm, we would be unable to inhale or breathe in. The phrenic nerve originates near the cervical plexus, which is right here, from nerve root levels C3, C4, and C5, although the largest contribution is actually from the C4 nerve root. One way you can remember this is C3-4-5 keeps you alive. If we can't breathe in, we're not going to be alive for very long. Now, an important note here is that the phrenic nerve is a mixed nerve, having both motor and sensory components. We normally think of the phrenic nerve in terms of its motor function, innervating the diaphragm. However, it does have a sensory function. So the motor component of the phrenic nerve obviously innervates the thoracic diaphragm. And then the sensory component receives visceral sensory input from the fibrous pericardium around the heart, the mediastinal pleura, and the diaphragmatic peritoneum. Now, if you look at the bottom of this image, you see the phrenic nerve, which continues to descend inferiorly, and we'll pick up with that on the next slide. But what I want you to see here are the contributions from C5, there's one there, contributions from C4, and then coming down from C3, so C3, C4, and C5. Little aside here, here's a table that shows functional abilities by level of spinal cord injury. So remember that the level of a spinal cord injury is the lowest level that still retains motor function. So if somebody has a C5 spinal cord injury, they still have C5 function and everything above that. So will the phrenic nerve be impacted by this? No. The phrenic nerve is C3, C4, and C5. This individual is going to have full function of their diaphragm, but other muscles, such as the intercostals, are going to lack function, in particular, the external intercostals, which also help with inspiration. What about a C4 spinal cord injury? Well, they still have C4 function, right? And that's good because the largest contributor to the phrenic nerve is the C4 nerve root level. So if we consider a complete spinal cord injury at the level of C4, the individual is going to have no function of C5, meaning the phrenic nerve is only going to have functional contributions from C3 and C4. Therefore, we can say that the diaphragm is still going to have some partial function, and depending on the overall function of the diaphragm and other factors as well, the person may or may not be ventilator dependent. And then if we consider a complete spinal cord injury at the level of C3, they're not going to have C4 or C5 function. In that case, the diaphragm is not going to be able to contract with enough strength to facilitate normal inspiration and keep the person alive. So somebody with a complete spinal cord injury at C3 is going to be ventilator dependent. C4, it depends on a lot of factors. They may or may not be, and they still might require some assist. A C5 injury, they're not going to be ventilator dependent, but in either of those cases, they're still going to be grossly limited in what they're able to do. So here you see the phrenic nerve descending inferiorly, and right here I boxed it in gold, and this darkened black line right here goes right to the phrenic nerve. It's right here. So what you can see posterior to that is the brachial plexus right here emerging from between this muscle, which is the anterior scalene, and this one, which is the middle scalene. Recall that between the anterior and middle scalenes right here, we have this triangle, which is the interscalene space, and that's where the brachial plexus emerges from as it goes down toward the axilla. So if you notice, the phrenic nerve is actually anterior to the brachial plexus when it emerges. What you'll also notice is that the phrenic nerve actually runs down the anterior surface of the anterior scalene. And then as it goes down more inferiorly, it goes over the dome of the pleura and then posterior or deep to the subclavian vein, which is right here. And once it goes behind the subclavian vein, it then enters the thorax. So what you're looking at right here is actually the right phrenic nerve. There's of course a left phrenic nerve on the other side that we can't see. And when each of these phrenic nerves enters the thorax, they're each going to take slightly different paths. But they're both going to maintain contact with the mediastinal pleura and travel anterior to the bronchus on their respective side. phrenic nerve. So we're looking at the picture on the right side here. So when the right phrenic nerve descends into the thorax, it's going to travel down the right side of the right brachiocephalic vein and the superior vena cava. So just to get your bearings, this is the heart. This is actually the right. This large, thick vessel right here that's going into the right atrium, this is the superior vena cava. And then up here, this is the right brachiocephalic vein. So you can see the phrenic nerve right here coming into the thorax. It goes over the right surface of the right brachiocephalic vein, over the right surface of the superior vena cava. And then obviously the right phrenic nerve is traveling anterior to the root of the right lung. Right here, number 3, this little thing right there, if you can see it, this is the main bronchus or primary bronchus. So this is definitely anterior to the root of the right lung. And then it goes over the right side of the pericardium. Now this portion of the pericardium has been removed, but it clearly goes over that. And remember that the phrenic nerve is going to give some sensory innervation to the fibrous pericardium, so that actually makes sense. Now as the right phrenic nerve goes past the pericardium right here, it's going to give off motor branches to the right side of the diaphragm, sometimes called the right hemidiaphragm. The left hemidiaphragm would obviously be innervated by the left phrenic nerve. Okay. Now, in addition to these motor branches that go to the diaphragm, there's little caval openings here that allow pieces of the phrenic nerve to go through the diaphragm. And this occurs to the right of the inferior vena cava, which you can't see right here. Once those branches of the phrenic nerve go through the diaphragm and into the peritoneal cavity, they actually give sensory branches to the diaphragmatic peritoneum. Remember, that's another piece that receives sensory innervation from the phrenic nerve. And so the terminal branches of the phrenic nerve are the motor branches that go to this side of the diaphragm and the sensory branches that cross through the diaphragm and give sensory innervation to the diaphragmatic peritoneum. The left phrenic nerve is going to take a slightly different path. It's going to descend into the thorax down the left side of the left subclavian artery. So this right here is the subclavian artery, where my mouse is, and over here is the left phrenic nerve. So this picture is not entirely accurate. It looks like it's going more anterior to it, but it's anterior and left of the left subclavian artery. And then what you do see here that is accurate is the phrenic nerve actually passes over the left side of the arch of the aorta. Here's the aortic arch. It travels over the left side of that. And then it's going to cross over the left side of the left vagus nerve. So right here's the left vagus nerve. Here's the left phrenic nerve. The crossing you really can't see from this view from the side, but if you were to look at this from the front, you would actually see them cross. And they don't cross like they're touching each other. You just see that cross when you're looking at it from the front. Okay? So, as it continues to descend downward over the left side of that arch of the aorta, it's going to cross anterior to the root of the left lung. Again, here's that main bronchus of the left lung. It's clearly crossing anterior to that. And then it's going to go over the left side of the pericardium. Again, here's the heart. This piece of the pericardium has been removed. But again, the phrenic nerve is going to give sensory innervation to the fibrous pericardium here, and also the mediastinal pleura, which is in this area. It's just the region of the pleural that's in the mediastinal region around the heart. Okay? And then crossing over the left pericardium going down, it's then going to go towards the diaphragm, as we already talked about. And very similar to the right phrenic nerve, once the left one goes down past the pericardium, it's going to give off motor branches to the left hemidiaphragm. And then also sensory branches are going to cross through those caval openings, and those are going to provide sensory innervation to the diaphragmatic peritoneum. Thanks for tuning in. Please like, subscribe, and check out my Instagram for cool science and not science stuff.